And now we have a special guest from the state of Andhra Pradesh. We are here in the inaugural of fourth edition of APAC HealthTech Innovation Conclave, focusing on southern India, southern part of the country. And now we have a special guest from the state of Andhra Pradesh, a senior IAS officer, G.H. Naveen Kumar. We welcome Sri Naveen Kumar. Thank you so much for joining us today. He's a special
Thank
secretary
you
of
so much.
Health, Medical and Family Welfare Department, Government of Andhra Pradesh, and he has been an avid user of technology for various policy implementation in various avatars in past few years. And today he'll be speaking about transforming healthcare in the state of Andhra Pradesh through policy interventions and technology. So, your thoughts on how healthcare can be transformed or is being transformed, especially by using digital innovation and technology? Your take on that, sir?
See, if you see how we, reacted or proactively or whatever word or resiliently, uh, enacted. You can use number of words to see how we, responded to the COVID pandemic as such. If you see, we were at lockdowns. If you see, there was a lockdown where there was no communication between people. So technology was the first mover in that entire lockdown time. And technology has been one thing. If you see, there is always a resistance to adopt to technology. But what COVID has done is, this pandemic has done is, it has put that factor, that the technology factor is a very very crucial component in everything you do in governance, be it training, be it assessment, be it anything, because your physical life is curtailed. So the trust factor to technology has tremendously increased in the last 2 years. People who are not used to technology have been forced to use technology, and that's how it's like it has got better. So I think it's now there's a with this, I think it's very easy to put technology in number of places, make people adopt it. And I'm very sure this, I think this is going to be the biggest change which healthcare will see in the future. For example, what we do in Andhra Pradesh is, if you technically see, the pandemic problem is a logistic problem, like I put it that way. Like, for a governmental point of view, it is a logistic problem. If the caseload starts arriving at the tertiary care hospital, you are choked. So you have to ease out the traffic which comes here. So what we did is, we started doing house to house survey. We proactively detected if there is a person with a COVID symptom or not. And if he is having symptom, if or she is having symptom, we give them some home isolation kit, and we keep a tab on that person, and we also take samples and send them for testing. Once that person is isolated and the medicine is there, in a day or two he must be okay, he or she must be okay. Or if it turns out to be positive, then the triaging happens. After the basis of triaging, whether we will be still we have to continue with the home isolation, or with the there's a triaging protocol, and or should we move him to the COVID care center or to the tertiary care. Entire delta wave we were able to do this one. And if you see, Andhra Pradesh, state of Andhra Pradesh is one of the few governments where the lockdown was fully not implemented. And we also have an 104 call center which calls the public, finds out whether, like, if you call that 104 call center, there's a telemedicine unit where there's a lot of doctors, not couple of doctors. They will ask you questions, they'll give you guidance. This is what you have to do. And proactively we were able to do all this. The confidence of the entire COVID, whatever the protocol was so high, the people were able to reduce their psychological fears also. There's a lot of psychological fear which happens around that time. So that is where how we use technology big time, ground level, telemedicine level, and tracking them. And I think state of Andhra Pradesh still is the only state which has less mortality rate. And I think it's also the one of the few states which had come out of this pandemic quickly with effective mechanism.
Right, right. As you mentioned, that trust to technology, that has been a game-changing thing which we have seen in last 2 years because of the pandemic. Mr. Naveen Kumar, do you think that time has also come when we talk about policy formulation, we give more focus on leveraging newest technologies for to reach out to the last mile with the healthcare delivery? So we should also relook at or re-strategize the healthcare policy formulation accordingly. What's your take on that?
Yeah, see, what if you have seen from September of last year, we have launched this Ayushman Bharat digital mission, where it's not just the technology putting in. You also have to standardize a lot of protocols. I use a different technology, others use a different technology. There's no point unless you bring all these technologies on a platform. There are certain standards which you have to follow, HEPA standards or the other standards, and people have to start doing it. I think that's the big way forward which we have done in the last couple of months. And this is not just imagine a guy, a small child who's born right now, all his records are available. 15, 20 years from now, anything happens to the child, every single record is available for the person to do make decision. So what we have done is not just, there are a couple of things which as we have done. It's not just decision making which we are enabling. We also would also know what is the future trend like. We will be able to ready ourselves for the future public healthcare, and that is going to be the biggest advantage of this digital healthcare platform which we are creating, and taking all the diagnostic unit, medical facilities, and the healthcare professionals will make this flow of information so easily that it's a completely going to a win-win situation for the patient. I think this is the first time we have actually made a patient-centric approach. Normally, when you create all these platforms, it's more of doctors or the ease of doing things, but patient is going to be the king or queen in this entire digital healthcare system which we are creating right now.
Are we well poised for Health 4.0 in the context of India?
Yes, I think we have this tendency to look at India not doing well. If you ask me which is the best digital healthcare country, it's Thailand. When we talk about you don't get a medicine unless you have a digital health record in Thailand. So that's the kind of spirit which we should look at. We should look at those examples. We think that America would be highly digitized. I think we have more digital data than America, I believe. Maybe I'm just throwing some words around. So, but my point is that we can surely become the best digital healthcare country in this world with a kind of, it needs a lot of teamwork, okay, and there's a lot of trust I think that's the reason I started this word called trust. Once the trust factor comes in, this is going to be the magical power which will bring technology to the ground, and it will be the largest enabler which will happen on the ground.
But so at the same time, there are challenges of the connectivity, reaching to the last mile, how to connect. Are we? Do you think that we can overcome those challenges in next 4 to 5 years so that the actual vision and mission of realizing the digital health transformation in India can be done in a smooth manner?
Yeah, this is where your design thinking will come in place. Okay, that's how human centric approach to the do I need a live connectivity when something is happening, when I'm putting a record, or that action can be done through an offline action, or do I have to fetch a record all the time? How am I going to fetch a record? Should I write that full code to put that record inside, or could I put a numeric code to send it so that the record is locally placed? These are the technologies which will be thought through, and I think that will become sea change in the entire system which is being we are developing.
Just taking cue from what we're discussing, what are your thoughts on leveraging emerging technology, especially for healthcare, like blockchain or AI, IoT? A lot of things have been used off late, but still a long way to go. Do you think that these emerging technologies can be a game changer in coming
Yes, I
years?
think I did a course on blockchain. I think I'm happy to work with some blockchain technologies because it's not just, if you ask me like this, I could not tell you whether it will work or not unless we do this proof of concept. Or I would love this word called proof of value. What is that value that emerging technology will bring to the cutting across the system? That is exactly what we should look at. So we are looking forward because I have a strong belief blockchain is, it's my belief right now. I cannot say that it will work. I can only say that it can bring a change. So it's a lot of technologies do bring a change. I'm a student of IT also, and also been implementing IT process for some time. I don't think even the smallest technology, you can see if you think of WhatsApp, it's a revolution by itself. So I don't think anything can stop you from there. But I again put it design thinking with the technology, which is going to be the game changer for a long, long time. So it doesn't it's not just the technologist will decide it. The approach should be that person who's using or person who are involved in that should carefully or involve themselves, participate themselves in that, creating that approach, the design human centric approach to the technology or using technology.
Right. As you have said that it's not about using technology, but the design thinking going behind using that technology and how and where this is going to help the end user. That is the citizen, the customers, the patients. That is most important. As you were saying that. Also, you talked about blockchain, in which you're saying that you're a believer that blockchain can transform. But again, we have to see how well we can use optimally to reap the benefits of this technology. At the same time, I have a question that if you talk about the various states, the various state models where a lot of things are happening. See, in Delhi, we can see a Mohalla clinic, which has been a success of late. Uh, but and various states have got their own programs which have seen success. Specifically, if we come to Andhra Pradesh, uh, if you just can list out some of the three projects which has been a game changer in the healthcare domain for
Okay,
our
I will tell
viewers.
you. I'll start with something which I was commissioner before. There is something called Grama Ward Sachivalayam in Grama Ward Sachivalayam Secretariat, Grama Ward Secretariats in Andhra Pradesh. For every 2,000 people population, we have a Grama Ward Sachivalayam. Grama, either a Gram Sachivalayam, Gram Secretariat, or a Ward Secretariat. What these secretariats would have is 10 manpower, which will include a digital assistant, and surveyor, a revenue officer, and a panchayat officer, and also a health other officer, and agriculture assistant, and another two three officers who would be placed the planning officer, etc., etc., sanitary officer, etc. These guys, imagine this one, for every 2,000 population we have this. So it's a huge department with 1.5 lakh staffing, and on the top of it, we also have a volunteer system. For every 50 households, we have a volunteer. So the kind of grassroots reach which we have using this system. So for technically put, I have an ANM for every 2,000 population. ANM. I'm not talking about ASHA worker. For every 2,000 population, we have an ANM. Along with it, we are also building Dr. YSR health clinics, which would be the primary contact for that person in the village for the 2,000 people. Vaccination, be it smaller this thing, even testing, diagnostic. We are also looking at telemedicine there. We're also looking at smaller approaches to medical approaches to that person. This is going to be like the way you called it Mohalla clinic. This would be the Mohalla clinic in every other 2,000 population. So it's, I think probably the idea came from there. So, and that's how we are going to put it. So it's a mix of, it's, I don't think we always used to technology. It's a mix of technology with manpower. That's how we got that system going. And that's why we were able to, I don't say we beat it, we were able to respond proactively to the Delta and also to the Omicron wave, which happened recently.
Right, right. Mr. Naveen Kumar, a lot of health tech startups and health tech industry leaders are present in this conclave on today and tomorrow for next 2 days. What will be your message for them in terms of where do you see government and industry coming together, or healthcare startups coming together to break up silos and build up the comprehensive, effective digital healthcare ecosystem? Your thoughts on that? What will be your message to them?
Yeah, if you see how the success behind the CoWIN portal is, the APIs were given to the startups and they were able to, reach out to more people. I think that's the biggest success. And that is the biggest openness from the government side. There's openness from the government side, to share data for you guys to, work around and bring a lot of synergies. It's not going to be an easy game, okay? You need a lot of understanding how government works. It's not the way it normally operates in your private world or something, but it's very different. We also have an responsibility to protect the citizens, the data around the citizens. But I'm very sure, like the previous question which you asked, the emerging technologies should be tested within the guidelines, or the IT Act and the Cyber Security Act and all, and other act for that matter. So we should be able to work around all this compliances. Also at the same time, you can also bring technology. I would call it compliant technology or technology compliant solutions for healthcare. So startups should also proactively not just look at technology, also look at whether it's compliant or not. So this would make the change which we are looking forward to.
Right, right. Thank you so much, Sri G.S. Naveen Kumar, Special Secretary of Health, Medical and Family Welfare Department, Government of Andhra Pradesh, for joining us in the inaugural and sharing your thoughts on technology, how it transformed the healthcare, and with a special focus on the state of Andhra Pradesh and overall how technology can be a game changer. You talked about trusting the technology, making the efficient, making the new technologies tested and compliant, and also it will be a mix of technology and human effort to build that comprehensive healthcare ecosystem. Thank you so much to GS Naveen Kaur for joining us today in the inaugural of fourth edition of Health Tech Innovation Conclave organized by APAC News Network. But before we move to the next speaker, a small token of appreciation from us to you for your work in over the years. As a policymaker who believes in the power of technology, we want to present you with the leadership award of APEC Healthcare, um, event. So here comes this certificate for you. So it's our honor to recognize your effort. The citation reads, this award is proudly presented to GS Naveen Kumar for his leadership role in the healthcare sector. This is APAC HealthTech Impact Award 2022. Thank you so much, sir, for joining us today. Do follow us and do guide us for our future path. With this, we move to the next speaker
Thank
of
you,
the
Thank you so much.
fourth Health Tech Innovation Conclave. Thank you so much.